Welcome to Mental Health, a COVID Crisis. I am Linda Rice, Vice President for Grant Making at the Hampton Roads Community Foundation. On behalf of Dr. Deborah DeCroce, President and CEO, and the Board of Directors of the Hampton Roads Community Foundation, I thank you for joining us this evening. We are pleased to have as our partner for this forum, Eastern Virginia Medical School's M. Foscue Brock Institute for Community and Global Health. This event is part of the Understanding Hampton Roads series, the Foundation's effort to advance civic engagement through forums on key topics to help build understanding, inspire action, and to bring people together to help improve life in our region. I want to thank the Foundation's Board of Directors and government officials who have joined us this evening. Since early 2020, with the realization that COVID-19 was taking a devastating blow on the world, our personal lives have been upended. Families have been disconnected. The loss of loved ones have left many grieving. Children have been schooled at home, often using unfamiliar virtual platforms. Parents or caregivers have been called on to teach. Social distancing has led to isolation. And many in our community have faced uncertainties in employment. And these examples only touch a few of the ways in which our community has been impacted. Today, we gather to hear from two outstanding researchers who are not unfamiliar with the ravages of disaster on mental well-being of families and children. Our speakers will be introduced by our forum moderator, Dr. Cynthia Romero, a Foundation Board of Director and the Director of the M. Foscue Brock Institute for Community and Global Health at Eastern Virginia Medical School. Our speakers share one major connection to the effects of disasters on families and children. Both research the impact of Hurricane Katrina on mental well-being. The schedule for this evening is a presentation by Dr. Gleason, followed by a presentation by Dr. Alexander. After both have presented, Dr. Romero will join them for a question and answer session. Thank you so much for the questions that you submitted during registration. We will cover as many as we can. Now we'll turn the program over to our moderator, Dr. Cynthia Romero. Please turn on your camera and your mic and join us to introduce our first speaker.
Thank you, Dr. Rice, and hello, everyone. The M. Foscue Brock Institute for Community and Global Health at Eastern Virginia Medical School is keenly aware of the health impacts of COVID-19 on people. And we've become more aware of how this virus has devastated some communities more than others. Our speakers tonight will address these disparities, especially in mental health, and will help us focus on long-term recovery, providing coping strategies to arm families and children for resilience in the future. Our first speaker is Dr. Mary Margaret Gleason, a pediatrician and pediatric psychiatrist at the Children's Hospital of the King's Daughters. And she is the Director of Child and Adolescent Psychiatry at Eastern Virginia Medical School. Dr. Gleason is excited to join the interdisciplinary Child Mental Health Team at CHKD, which is committed to expanding child mental health services in Hampton Roads, Virginia. Her work focuses on bringing quality mental health care to children where they are, in mental health, in primary care, and in community settings. Dr. Gleason, with your video on and audio on, we welcome you.
Good evening. I'm so excited to be here, and thank you for that lovely introduction. Oops. I'm particularly grateful to the Hampton Roads Community Foundation and to the Brock Institute for including me in this important topic. I'm new to the Hampton Roads area and thrilled to be part of the CHKD program that's really expanding our mental health services here, and excited to talk to you this evening about child and family mental health during this pandemic. I'll start just by acknowledging that we use the shorthand to say the COVID-19 pandemic to describe a year that has had so many changes, and that the impacts on families has been variable. Each element of the year has shaped each family's individual experiences differently, and the children's responses are related to the most important events that they've experienced. I also want to start by recognizing that although we call this event unprecedented, and in many ways it is, it's not the first disaster and it's not the first pandemic to arrive. I'm particularly aware of that because I'm the great-granddaughter of a woman who died in the Spanish flu in 1918, leaving a toddler who grew up to become my grandfather. As I thought about this during the pandemic especially, I'm aware of the ways that his upbringing by a neighbor who was a wonderful foster mother changed his life, and the ripples that have affected us down the generations. And so I know that what we experience today will continue to have impacts on the next generation and probably generations to come. So what do we know about disasters that have occurred? Most of the research does not come from the Spanish flu. Most of the research comes from more recent disasters, often natural disasters. And what we learn is that many children after major events and during chronic major events don't have major emotional behavioral changes, don't develop psychiatric disorders. That it's very common, though, to have some changes that are transient emotional behavioral patterns, and that they're not usually a sign of something bigger. We do know that some children, sometimes up to a half, but usually in the 30% range, depending on the disaster, the age, and the particular circumstances, some children do develop serious mental health problems. And we know, and this is probably the one thing that I hope you take home with you, that parents, and when I say parents, I mean parents and caregivers, that may be grandparents, it may be neighbors like my grandfather had, whoever is serving the child's in the child's life as a caregiver. These adults play critical roles in children's response to crises. I'll be emphasizing that tonight, and also want to emphasize that adults don't need to be perfect to protect the children that they're caring for. I'll also acknowledge that for some children, the experiences of the last year have brought some respite and some silver lining. Some children have benefited from the decreased academic or social stressors that they may have experienced in traditional school settings. For some children, the changes in schedule have brought them more time. This can be exhausting for everyone involved, but it can be a real blessing, for a gift for children. For some children for whom the pace of school is a little bit more pressured than their internal pace, the unstructured time has been valuable. And others have learned new skills and developed, explored activities that they might not have done in normal days. And Dr. Alexander will talk more about this, but for some children, there have been opportunities to make a difference in the world, advocating for others, serving others, and mobilizing themselves to address some of the impacts that have come in the last year. At the end of the day, what we know is that resilience comes from children being exposed to a stressor at the same time that they have either adequate support or adequate internal resources, the ability to have feelings, have stress, and stay calm and cool. What do we see in most children? What I'd like you to do is to look at the bottom of this slide first, actually. Across the ages, from 3 days of life to 103 years of age, sleep changes, eating changes, mood changes are all elements that we can see when people experience stress. The other kinds of changes are related to a child's developmental level. I included infants on here to remind us that infants have feelings, experience feelings, and can experience the stress of the people around them and the protection and the comfort of the people around them. At each other age, we know that the developmental skills that a child is learning shape how they experience the stressor in the pandemic. Preschoolers may have magical thinking. They may think that because they had a tantrum or were rude to their grandmother last week, that's why she got sick. That's a magical thought that they have more power than they actually do. School-age children tend to focus on rules, right and wrong, organizing the world. That's what their developmental task, and that may shape how they respond to the pandemic. In them, we often see more anger, sometimes physical aggression. And we can see that they may focus on death and dying, and even on thoughts of self-harm or suicide. And adolescents are more abstract thinkers, so they may be thinking about things like justice or injustice. When they're stressed, they may withdraw socially. We may see them have less energy, more irritable, which can feel like talking back. And they may experience more concerning symptoms or patterns like suicidal thoughts or health risks like drinking or alcohol or using drugs. All ages of children can have responses to the stressor. We worry when these patterns are persistent, so more days than not, more of the time than not, or are severe. Thinking about death and dying is always a concern. Most importantly, we pay attention when these patterns get in the way of the child doing what they need to do: participate in family activities, connect with friends, participate in school. So what do we know from our history about the long-term implications of disasters? One of the most concerning patterns is that in most disasters, most child mental health needs are unmet during the disaster and after. It may be because parents are focused on basic needs. Where are we living? How do we get food? It may also be because as a society, we tend to say that if we know why someone is having emotional or behavioral symptoms, we don't need to worry about addressing it. And that's a logical flaw. We never say that when someone has a car accident and has a broken leg. But we do know that in disasters, people will say, I know why she's sad. I know why she's irritable. Of course she is. Look at what's going on around us. And sometimes that gets in the way of children getting the services they need. And we know that symptoms, including suicidal symptoms, including in preschoolers, can persist for years. And that the symptoms that children develop during disasters interfere with their learning, with their development with peers, and with connecting with their family. So what do we know so far about the experiences of the COVID-19 pandemic and all that it has brought with us? The bottom line is the protective systems, the things that protect children's mental health, are weakening and being eroded. For many families, access to basic needs is limited or more stressful. Many adults are experiencing mental health problems themselves. And in fact, a quarter of adults back in June, which in the childbearing years, reported that they had had suicidal thoughts. Some children are exposed to unsafe conditions in their home and watching the people who are supposed to protect them hurt each other through domestic violence. Schools played a particularly important role in protecting children and haven't been able to observe and monitor children for child maltreatment in the ways that they normally would. And we know that the impacts on children and families have been disparate, affecting Black and brown children and children in poverty more than other children. There's been a lot in the news about the negative outcomes, mental health outcomes in children. And the truth is right now, the outcomes are pretty variable in the research. We know that there's studies published every day, and the outcomes depend on the timing. Which month were they looking at? The place that the study happened, the access to mental health services in that community. But taking them all together, we know that there are increases in children's mental health, children's visits to emergency rooms for mental health concerns, for substance use, for child abuse. We do know that some children are doing better. And we also learned from other countries that returning to school is not a panacea and doesn't erase some of the other challenges and mental health symptoms that children may be developing. The other thing we know that delayed effects are very likely based on from our other experiences with disasters, and that many of the studies don't include information about the start of the school year. Here at CHKD, we know that the children coming to our emergency room have higher rates of suicide risk now in the last 4 months than they did last year. So we expect that more published studies will also show that. We also have great information and growing information about what is protecting children right now. The themes are maintaining family routines is beneficial to children's well-being. Families that have continued their eating dinner together, if that's what they did before, or other kinds of routines, or have children who have fewer mental health symptoms right now. Children who are receiving mental health services are getting better despite receiving those services during the pandemic. And there are data that say that children whose parents and caregivers are less stressed are doing better. I put that in parentheses because the take home isn't to tell the parents or caregivers on this webinar not to stress. That doesn't help. But it is important that we as a society think about how do we support these caregivers, making sure that we can minimize the stresses on parents to reduce the symptoms in children. Because at the end of the day, it really does take a village. It takes everyone's involvement, from parents, educators, worship communities, policymakers. We all need to be involved in protecting the well-being and mental health of children. And I hope that this conversation focuses not on each individual parent and educator feels responsible for making everything better. That cannot happen. We really need to be working together on this. And to do that, we all need to take care of ourselves. And taking care of ourselves means also accepting help from others, which many people struggle with. We should be taking care of our physical and emotional needs. That may be eating right, getting sleep. It may be making sure that we take the medications for physical health conditions and mental health conditions, and use the coping strategies that we've used before that we know work for us. One of those is usually to stay connected to people who are supportive. The other thing is we've been learning so many new ways of living. Talking to you on a webinar through Zoom, going to school through Zoom, working through Zoom, interacting with people at work with masks. All of these are new skills. Learning new skills takes energy, and we sometimes mess it up. So be gentle for ourselves and assume that the person next to us is also going through the same thing. For people who work in professional careers with children, the other thing to pay attention to is to monitor ourselves for burnout, to ensure that we're looking out for ourselves and for our colleagues. That sounds sometimes like a big lift. So I've included in the resource handout some apps that are free. These are publicly developed that provide some strategies for doing some of that self-care, relaxation, paying attention to feelings, and to thoughts. One of the skills that goes across all ages that I use almost every day in my practice is teaching relaxation skills. And we can all do it. And it's amazing what, for example, slow, organized breathing, sometimes called diaphragmatic breathing, can do. I literally have a bottle of bubbles in my office and use them even over Zoom to teach young children to take charge of their body, to take charge of their breathing. And to start to organize their feelings by organizing what's going on in their body. I included a link to a very short video that some of you may have seen. 6-year-old boy teaching his younger brother to breathe and calm and to avoid a temper tantrum. It's a beautiful thing if you haven't seen it. What can parents and educators do? And I originally, when I started these slides, I had them separate, actually, parents and educators. But I think at the end of the day, what we all can do as we want to work to protect children's mental health are two major things. The first one is to keep life predictable and safe. Using COVID precautions, mask wearing, social distancing, actually can decrease children's anxiety and improve their mental health, knowing that people are looking out for them and people are following the guidelines. It's important for children's lives to stay predictable from the perspective of the kinds of expectations that people have for them. Now, we all have had some loosening of expectations in some areas of life, but at the end of the day, the behaviors that were fully unacceptable before the pandemic should stay fully unacceptable now. There should be consequences for behaviors that are unacceptable, and there should be reinforcement for behaviors that parents want to see. Another way of keeping things predictable is maintaining routines, both in the classroom and in the family setting. Those could be bedtime routines, it could be eating dinner together, whatever it is that allows the world in the home or in the classroom to feel organized when so many other elements of life have been so drastically changed. I've talked about connectedness. Parents and educators and everyone who works with children can also support children's mental health by making sure they have the opportunities to stay connected with their friends, their peers, and their family. That can be through in-person opportunities, as our weather here in Hampton Roads has really taken a beautiful turn lately. It can also be through Zoom and other remote connections and teleconnections. That being said, I'll also mention that most families have had screen time rules before the pandemic, and we should continue to have screen time rules, despite the fact that the number of hours that every person I know spends on Zoom or other screens has increased. It's important for families to pay attention to whether their child is watching things, interacting with things that are developmentally appropriate, and particularly monitoring what children are getting from news sites and social media, and being ready to talk about what children are seeing, both in news and social media, recognizing cyberbullying has not gone away. The other part of the other lesson, I think, for disasters and this pandemic is to acknowledge that despite the fact that we're keeping things predictable and safe, life is different. So sharing information about the pandemic, about the work for racial justice in ways that are manageable for the child developmentally. I often talk about telling the truth, but not necessarily the whole truth. One of the ways to titrate and make sure that the information matches your child's developmental needs is to ask them what questions they have and answer those. It's important to talk about feelings. Feelings are a part of life, no matter what. We're going to have them now and after the pandemic. With young children, giving them words to talk about the feelings and know what, and have tools to label this internal experience that's happening to them. For older children and adolescents, opportunities to, when parents can describe what they're seeing in a non-judgmental way, saying it looks like it's harder for you to get up in the morning. It looks like it's hard to stay calm sometimes when things are frustrating. Often these conversations are best had not in the moment of the strong feelings. And as I've talked about the importance of routine, maintaining routine, there's a monotony to some people's family life right now. So it can be useful to have something special, have breakfast for dinner, take dinner out to the beach since we live in a beautiful place. A treat essentially. Another valuable experience that can empower children and improve their mental health is giving them opportunities to do something that changes the world. It can be as simple as using chalk on a sidewalk and sending messages to neighbors. And it can be more externally focused and bringing food to food bank or supporting people who have fewer resources. And both in school and at home, noticing children's efforts. As I said, it's a lot of work to get through a pandemic. Praise the efforts. Let them know that you're seeing what they're doing and the work that they're trying to do. Lastly, for both parents and educators, your relationships are the key to your child's mental health. Knowing you're there for them will help them through each of the days that they have during this pandemic. As a society, as a group, we need to all be working towards protecting the foundational ingredients that we know contribute to children's mental health, making sure they're safe, making sure that their basic needs are met. And as a tangent, I think that the schools have done a really nice job of getting food and school lunches to families that need it. Making sure that caregivers have what they need to be okay physically and mentally, which means access to physical and mental health services. And I think it's time for us to be thinking about integrating information about emotional health and coping strategies into education, starting in childcare and going through secondary school. And certainly children are safest when the world treats them with justice. So what do we need to look for? I've already said this, but I wanted to emphasize in this slide again. Major changes that are persistent, that don't go away, that are happening more of the time than not, and that get in the way of a child's functioning, and certainly put the child at risk when we think about suicidal, talking about death, talking about substance use, talking about self-injurious behaviors. So what can parents do? Talk about it, talk about feelings, talk about what you've noticed in a non-judgmental way, and describing what are the things that the parents noticed and conveying that you're worried. Expanding the team to your social network, trusted friends, trusted advisors, and also asking for help from your child's pediatric primary care clinician, school counselors, mental health providers, and for every child all of the time, but especially when there are concerns for mental health, making sure that your home is safe from the perspective of firearms, lethal medications, to prevent a child being able to access something that could hurt them if they have suicidal symptoms. There are resources, and it's useful to have these available. Google them. They are in the resource handout as well. And I've also included some tools that can be useful to talk about in more detail how we can help children. Here in our area, I couldn't include all of the amazing agencies that support children's mental health, but did want to remind people that the community service boards for each county are available to provide mental health services for adults and children. We here at CHKD and other organizations are ready to provide developmentally specific services for children who have mental health emergencies, and we're working to expand our capacity in our outpatient world and building a new mental health hospital where we'll be really able to serve children who have mental health needs from mild to severe. So in summary, I think the important messages are every person has been affected by the events of 2021, of the last year. And these events do put some children at higher risk for mental health problems, and they're the children who were at higher risk before for the most part. We know that parents, educators, and all of us together can play a role in protecting children's mental health. Dr. Romero, I look forward to hearing Dr. Alexander's remarks now, and then to answering questions at the end of this session.
Fantastic. Thank you so much, Dr. Gleason, for those most insightful remarks. Let us now turn to our next presenter, Dr. Adam Alexander, who joins us from his office at the University of Oklahoma Health Sciences Center in Oklahoma City, where he conducts research and teaches in the Department of Family and Preventive Medicine. Dr. Alexander leads an interdisciplinary research team focused broadly on reducing health disparities with the specific goal of understanding and intervening on the social, biological, and behavioral determinants underlying health disparities among African Americans. His work extends from the laboratory directly into the community. A large portion of Dr. Alexander's research has highlighted important racial disparities in mental health outcomes and changes in substance use behaviors after a natural disaster. After completing his PhD in social and behavioral sciences at the University of Memphis, Dr. Alexander was selected as a 2019 National Institute on Minority Health and Health Disparities Fellow. Dr. Alexander, please turn on your video and audio and share your insights on the impacts of COVID-19 on mental health. Welcome.
Good evening, everyone, and thank you, Dr. Romero, for the wonderful introduction. Today, I am very excited to talk with everyone about how you can maintain and improve your mental health during times of great change and crisis. Before I begin, I'd like to give you a brief background about my journey as a researcher. My first paper I published examined mental health outcomes after Hurricane Katrina. Briefly, Hurricane Katrina was a devastating hurricane that struck the Gulf region of the United States in 2005 and killed 1,800 people and caused $125 billion in property damage. I was concerned about the racial disparities and mental health outcomes after Hurricane Katrina because that disaster significantly affected African Americans in New Orleans, Louisiana. Many African Americans lost their jobs, homes, loved ones, and some had to relocate to new areas across the country. My research showed that African Americans were still dealing with the trauma of Hurricane Katrina in the form of depression and post-traumatic stress disorder many years after the event. Researching Hurricane Katrina taught me that even though times carry on, people move on, and once traumatic events fade into the distant past, the memories and scars remain, and it's up to us to determine how we find meaning in our grief and suffering. This realization motivated me to discover simple ways folks can remain strong and resilient during the COVID-19 pandemic. Before I talk about these strategies, I'd like to describe the circumstances we currently face together as a nation today. In slightly over a year, the United States has about 30.4 million cases of COVID-19, and 551,000 Americans have died from the virus. Minorities in Virginia and across the nation are the hardest hit by the COVID-19 virus, as you can see in the figures in this slide. Over 20% of Americans, or around 20% of Americans, have lost someone to COVID-19. And the same pattern is seen here. Blacks and Hispanics are more likely to report losing someone to the virus. Nonetheless, as a nation, we're all mourning something during this time, whether we're mourning the loss of our jobs or reduced wages, whether we're mourning, and some of us, in fact, are experiencing multiple losses from COVID-19. Families are also uncertain about how long their bout of unemployment will last. Children are confused about when or whether they will return to school. And many are left wondering whether life as we knew it will return. Simultaneously, we're also anxious about whether we or a loved one will become infected or die from the virus. Other folks, including young people such as myself, are grieving the loss of significant life milestones, such as weddings, graduations, and family reunions. The society that we lived in and started families in is changing before our very eyes, and the uncertainty about what lies ahead is driving us mad. The COVID-19 pandemic has negatively affected people's mental health and created new barriers for people who already suffer from mental illness and substance use disorders. 4 out of 10 adults in the United States have reported anxiety or depressive disorder symptoms, which is more than a 4-fold increase since 2019. 36% of Americans are reporting difficulties with sleeping, 12% are increasing their alcohol or tobacco use, and another 12% have worsening health conditions due to worry or stress about the COVID-19 pandemic. However, this burden is not shared equally around the country. There are roughly 55 American workers who conduct a range of operations that are considered essential for society to function. I want to talk about the healthcare workers briefly because they represent 30.2% of this sector. Today, most healthcare workers are feeling stressed, anxious, frustrated, exhausted, overwhelmed, sad, underappreciated, lonely, and powerless. This is reported by more than 50% of healthcare workers across this country. These feelings may be contributing to a high rate of emotional exhaustion seen among healthcare workers today. Around 82% of all healthcare workers are reporting that they're feeling emotionally exhausted. In addition, 40% of all healthcare workers are saying that they're not receiving adequate emotional support on the job or at home. In addition, healthcare workers with relatives living with them are anxious about spreading the virus to their loved ones. And this is especially reported by healthcare workers with children. 76% of healthcare workers with children are reporting that they fear spreading the virus to their child. In addition, most healthcare workers are reporting difficulty balancing the workload as well as duties within the household, such as cleaning and cooking. This is reported by many nurses in our country. Around 70% of nurses are reporting difficulty balancing work tasks with home chores. And this is important because in this country, 91% of our nurses are women. And working women, especially working mothers, are having an especially difficult time during this pandemic. As you can see in this slide. The simultaneous closure of schools and daycares and social distancing guidelines preventing working mothers from asking grandparents and friends to allow their kids to visit their houses to have some relief is really complicating the ability to work and attend to the home. As such, many working mothers are around 25% actually are reporting that they're considering leaving the workforce or reducing their hours at work in order to spend more time in the home. These disparate circumstances between working mothers and working fathers who are having, I think, a better time during this pandemic compared with working mothers could have significant long-term ramifications for women in the workforce. Now, another group we need to talk about here are young people. We tend to equate loneliness and isolation with our senior citizens, which is true, but the COVID-19 has devastated young people, especially those who are 18 to 24 years old. Many young adults have left their parents' home and they're entering college for the first time, or they're just graduating college and they're integrating into a new community. When the pandemic started and restrictions were put into place, many young adults had to force themselves to be in their homes and in their apartments and avoid other people to reduce their chances of getting the virus. Loneliness, I think, during a developmental period where social connectedness is essential for growth and success in modern America, is a recipe for psychological distress. However, despite facing high levels of mental health problems across many segments of the population here in the United States, mental health service utilization is down by 8%. Even amidst the pandemic, seeking help from mental health professionals has always had significant barriers. I don't have time to mention them all, but I can talk about some of the important ones. I think the first thing to talk about as a barrier to mental health treatment is just the cost of mental health care is very high, even with insurance and financial assistance. Second, there is a shortage of mental health professionals across the country. This is particularly felt in our rural communities. In our rural communities, there's almost no mental health care providers at all. And third, this is more related to families and individuals. People fear that families, friends, and coworkers will avoid them or treat them if they say they're seeking treatment about their mental health problems. So there's still a stigma attached to seeking mental health care in this country, and we need to do something about that. And last, and this is very important, we often dismiss mental health problems as personality issues and attitude problems, even though they represent severe psychological distress in some cases. And people who are suffering from these conditions often do not express their suffering to others. They keep that within. And hopefully the next slide will visualize this very well. So if you're seeing this slide, what you see is a person who internally they're saying, help me, help me, help me. But when they vocalize their thoughts, they say, I'm fine. So why is that? So even during times of crisis, some of us will walk, will talk and act as if we're fine, even though inside we're suffering. Many of us will do this because we have those who rely on us for support. If they know that we collapse, we think they will too. Today, I'm going to give you a few strategies that, if properly implemented, will help you weather the storm a little longer. These actionable and straightforward tips will help you become more resilient. Resiliency is a psychological term that refers to the ability to effectively cope with a crisis mentally and emotionally and to return to pre-crisis functioning very quickly. A common mistake that people make is they think that resiliency is innate, meaning that you're born with it or you're not. However, resiliency is learned through our life experiences. Resilient people are less likely to feel depressed or anxious during times of disaster and uncertainty, and are less likely to engage in poor health behaviors to cope with stress, such as substance use and binge eating. So let us talk about the first strategy. So we're trapped in a prison of negativity. And what do I mean by this? Have you ever done a Google search of COVID-19 and went to the news section? What do you find? Well, look at the headlines. I pulled a few for today's presentation. Well, here's one. Cases and hospitalizations are on the rise. We can't afford to let our guard down, the CDC director says. Second headline, 2,252 new COVID-19 cases, 36 additional deaths reported in Massachusetts. Third headline, over 100 fully vaccinated people contract COVID-19 in Washington state, officials say. So what's the common theme in these headlines? They're all negative. And the research clearly shows this. News articles in America are mostly negative, no matter what COVID-19 is doing in our country. Whether cases are down, stories are still negative. If cases are up, stories are still negative. If you compare that with the worldwide coverage of COVID-19, you find that the international press is much more in line with how COVID-19 is working its way throughout the world. And so why is this happening in our country? Well, you know, journalists and news companies understand human psychology very well. They know that we as people are more attentive to negative news stories versus positive news stories. Think about like this. Do you pay more attention to your child if they receive an A or an F in class? Well, the same principle applies to media. A large body of evidence suggests that we are more psychologically activated by negative news stories versus positive news stories. While these emotions, and so the news agencies have been feeding you stories that stoke fear, anger, and resentment, all negative emotions. And while these emotions may wildly increase revenues for media companies, they are corrosive to the human psyche because our emotions influence our thoughts and our actions. So here's a simple recommendation. Take a break from watching the news. Consider hiding the comments from friends and families who post mostly negative stories on social media. Take a long walk, take a relaxing bath, read a great book. Just tune out society for a couple of moments. I promise you, it'll still be there when you return, and focus on your health and yourself. And this relates to the second point, or the second strategy, the power of positive thinking. So the power of positive thinking can be best summed up by the phrase every parent tells their kids: when life hands you a lemon, make lemonade. We need to balance negative thinking with positive thinking. Positive thinking starts by confronting the negative Nancy or Ned that may live in your head. Negative thoughts are often automatic and are based on your current disposition and accumulated life experiences. My advice would not be to ignore or avoid these thoughts, but to accept and acknowledge their presence and provide a space for positive or optimistic views of the present situation. At first, it will not be easy because it will require conscious effort to think positively. But as you practice it more often and are rewarded through improvements in mood, self-esteem, and even improvements in physical health, it will become easier to engage in positive thinking. I think a great way to start thinking positively is just to go out and work in the community, volunteer. I think the pandemic has prompted us to become more isolated people. However, as we transition back to a new normal, a great way to jumpstart your mental health is as I said, go out and serve others. The scientific evidence is cut and dry. Volunteering in the community decreases mortality, improves self-rated health, mental health, life satisfaction, social interaction, and health behavior. I'm going to give you an example of this. During the pandemic, churches in Oklahoma worked with World Vision, a nonprofit organization, to provide more than 2.2 million pounds of food to 50,000 families and over 150,000 people. We put a lot of smiles on people's faces and we enjoyed it ourselves. And we did this all while abiding by proper safety guidelines. And last, I think this is something that always needs to be mentioned, is I need to talk about the interconnectivity between diet, exercise, and sleep. The pandemic has turned us all into couch potatoes, if I can speak frankly. We're binge watching Netflix, Hulu, Amazon Prime, and we're eating a lot of sweets and drinking soda. In addition, chronic stress, inconsistent work schedules, homeschooling kids, work loss, financial impacts, and increased screen time have contributed to many of us becoming sleep deprived. The lack of exercise, poor diet, and inadequate sleep is doing colossal damage to our psyche. The problem and the solution lies in the interconnectivity of these behaviors. If you sleep poorly, you'll feel less motivated to engage in physical activity and more inclined to eat foods that are very caloric, such as very sweet foods or fatty foods. In contrast, if you regularly engage in moderate to intense physical activity, such as jogging or weightlifting, you eat foods that are high in tryptophan, such as turkey and chicken and dark chocolate, then you may be able to improve your sleep. For those who feel uncomfortable exercising in crowded spaces, I really recommend that you try some mind body techniques such as yoga, meditation, and deep breathing exercises at home. There are many YouTube videos that will show you how to do this. So to conclude, I believe that the pandemic has humbled us and made us more grateful for the things we took for granted. At the height of our ambitions, we once dreamed that we would colonize Mars and cure cancer. Now we simply wish to shake a stranger's hand or to hug our loved ones. The pandemic is a black swan event that no one could predict or be responsible for and has crippled the entire world. You are not alone in this struggle because we're all trying to stand back up. Although the pandemic may give you a sense of dread and inevitability, you're not powerless. You have the power to reshape your life and the lives of your family for the better. You can regain control of your life by tuning out the negativity and engaging in positive thinking, serving the vulnerable in your community, and improving your health behavior. To those who are feeling powerless, please find courage in this powerful quote about perseverance, resilience, and hope. We all fall down. It's fine. Get back up again. Everything will be okay. I pulled this quote from an anonymous person on the internet. Who knows? Maybe that person was you. Thank you for listening to this presentation. I'll look forward to joining Dr. Gleason and answering questions from Dr. Romero in a few moments.
Wow, thank you, Dr. Alexander, for that excellent and informative presentation. We clearly could have had one session with either speaker, right? Now we will be joined by Dr. Gleason for some questions. We'll start first with one to Dr. Alexander. Dr. Alexander, what lessons did you draw from looking at data from Hurricane Katrina that is informing your research efforts, especially on COVID-19's mental health impacts on families?
That's a great question. I think there's two things I learned from Hurricane Katrina. One, you have to look at the long-term consequences of the disaster. You can't just focus on the short term. In the case of Katrina, the victims of that hurricane did not just suffer for a year, they suffered for 10 years. And so we have to understand that the COVID-19 pandemic today is not just creating dire circumstances for people, it's going to be creating dire circumstances for people 10 years from now. And if we don't have the solutions in place that offer long-term fixes for problems, then we're going to be setting ourselves up for a worse crisis down the road. And second, the second thing I learned from Hurricane Katrina was that certain populations are affected more so than others by a traumatic event. In the case of Hurricane Katrina, we found that African Americans were disproportionately affected by that hurricane. And the same pattern is seen today as well. And we need to know which groups are being affected by these events in order to be able to properly allocate the resources so that everyone can have an equal opportunity to recover from the disaster, in this case, the pandemic, and to come out swinging in terms of being revitalized and having, I think, improved mental health. So.
Great, thank you, Dr. Alexander. And Dr. Gleason, how are the lessons learned from your time dealing with families and children during the disaster of Hurricane Katrina, guiding your work now during the pandemic?
So I had some similar lessons as Dr. Alexander, but I'll start with the strength that I so appreciate in my colleagues in New Orleans, as well as the community in New Orleans and the whole state of Louisiana. The resilience that people demonstrated, the community connectedness that developed among many people to work towards recovery is inspirational. And I think an important lesson for us to be thinking about today is how do we come together and how do we work towards a recovery? I also, though, think that there were two groups of children that I spend a lot of time thinking about still. One are the silent sufferers. I spent some time after Hurricane Katrina and Rita volunteering in a shelter. There were two children that I'll mention to you. One was a 12-year-old girl who developed suicidal thoughts while she was in the shelter. And her mother was so distressed by everything going on that she wasn't even able to be emotionally available or to talk about her daughter's symptoms and her daughter's depression. And in fact, was spending some time outside of the shelter drinking alcohol. The other little boy that I think about a lot is a 3-year-old. His mother brought him into the bathroom in the shelter to hit him with a belt because she was worried that his behavior, typical 3-year-old behavior, was going to get them kicked out of the shelter. Both of these children, I worry, represent many other children in Hampton Roads around the country who are silently experiencing the acute stresses of our current disaster. The other group of children, similar to Dr. Alexander, are the children who didn't get help for years. And in that category, I think about a girl who I met when she was 10, 5 years after Katrina, who for those 5 years wouldn't go to school, wouldn't separate from her mom, wouldn't take baths because she had walked through water to safety after the storm and was terrified and been separated from her mother when they got to the Superdome. So I think about those children, and I think that the lessons that I take are we need to be actively looking for the children who are silently suffering. We need to be building a plan for meeting the needs of what I expect to be many, many children who have residual symptoms, suffering over the next years.
Great. Thank you, Dr. Gleason. And Dr. Alexander, we know that you are concerned about the impact of the pandemic coupled with racial unrest in our country. How has the pandemic, coupled with the racial unrest, impacted families of the Black and Brown community?
This is an excellent question. And I must say, I just need to acknowledge that the current social climate in this country is not the best. On January 6th, protesters stormed the Capitol. A few months later, a person shot groups of minority women working at a massage parlor. Just a couple days ago in Minneapolis, another African-American was killed during a police encounter. Minorities during this time have faced added stress in addition to the pandemic. I recently went out to lunch with a colleague who's from South Korea, and we were having a conversation during our lunch, and she said, Adam, I'm not going anywhere right now. And I said, yes, that's understandable because of exposure to COVID-19. She said, no, I'm not worried about COVID-19, not anymore, I'm vaccinated. She said that I can't go outside because I fear that someone will attack me. And as I said, she's from South Korea. And so I think we need to have a conversation about this current social climate in our country and the impacts it is having on minorities, such as African Americans, such as our Asian minorities, because this is going to cause additional conflict. Once we're done and everything with this pandemic is over, the social conflict is still there. And that's something we need to address. And that's something I'm addressing in my research. So.
Thank you. And back to you, Dr. Gleason. In Dr. Alexander's presentation, he touched on self-care as a critical component in everyone's ability to rebound psychologically from COVID. What does self-care look like for children who need support in building their resiliency?
Absolutely. So I think the first thing is that self-care by definition is team-based care for children. Parents, other adults and caregivers around them are responsible for helping them learn the skills to have strong feelings and stay safe, not hurt people, continue relationships. That's what we call emotional regulation. And each day of a child's life, they're learning how to have a feeling and how to respond to it from the way that their caregivers respond. Early in life, the lesson comes from having an experience, signaling to someone by crying, by kicking your feet, and having someone respond and meet your needs. As we get older, children have the capacity to start to learn to calm themselves a little bit. I mentioned that preschoolers can learn to do relaxation strategies like breathing. As school-age children, adolescents, we can make more sophisticated approaches to relaxation, still breathing, maybe a little bit of mindfulness, maybe learning coping strategies of going outside, spending some time with other people, listening to music, staying connected to the most important people in their lives. I think these are some of the strategies that really are universal across all ages, that we as adults can support children in developing while they're facing the difficult challenges of the COVID pandemic.
Great, thank you. And then back to you, Dr. Alexander. COVID conditions have left many adults feeling like they've hit a brick wall or feel like they're finding themselves in quicksand. Isolation, coupled with uncertainty, have contributed to feelings of depression, burnout, lack of energy, a sense of chronic stress, or all of the above. Can you remind us again of some effective ways for people to address these conditions, either individually or together?
Yes, yes. And I think if the audience could take one thing away from this presentation, please turn off the media. Just take a week, turn it off, because it's so negative right now. And when they're feeding you all that negativity, they're stoking negative emotions within you, anger, resentment, and fear. And those emotions are going to influence your every thought and every action, and even your interactions with others. And so turn it off, engage in self-care. And one of the best ways of doing self-care is engaging in positive thinking. Begin to think more optimistically about some of the situations that are going on in this country. Maybe read more positive stories about the COVID-19 cases or the success of the vaccine. And I think the second thing people can do is just make improvements in their health behavior. Start engaging in exercise. I know that the pandemic has made us more sedentary, but please, gyms are reopening. There's a beautiful environment that we all live in. You can engage in walks. Just get out, exercise. You'll find that makes a lot of improvements, both to your physical health and your mental health. So that's why I'll suggest all things today.
Great, well said. And Dr. Gleason, what are some key concepts that families can use to talk with their school-age children regarding stress and mental health that can allow them to keep the conversation going and not be overwhelming?
It's such an important balance that families and we all face. A couple things that I would say there. One is label feelings. Notice someone's having a hard time and just recognize that the feelings are real. The goal is not to not have feelings. The goal, of course, is to have feelings and be able to get to the next activity the next day and maintain relationships and get through the activities that need to happen. So with school-age children, talking about feelings is the first part. Asking them how they're doing. Doesn't need to be 15 times a day, but in a quiet time when things aren't so stressful, when things aren't so busy, checking in. How are you doing with all the things that are going on right now? Can be a nice opening. Doesn't need to be filled with pressure, but families can also say, I noticed that you had a hard time when your brother took your toy, or that something like that. It looked like it was really hard for you to stay calm. I think the other thing is to model talking about our own feelings. Parents are struggling sometimes. Dr. Alexander shared some statistics that are really important. Some of us are going to get angry. Some of us are going to look sad. It's okay for children to know that we know that that's showing. And to say, I felt sad yesterday, and I'm sorry that I was louder than I wanted to be. Those kinds of expressions of I had a feeling, maybe I didn't handle it the way I wanted to, or the way I'd like to the next time, give children the message that we're all learning, we're all working on this, and no one needs to be perfect in addressing the challenges that we're facing each day. And then the other piece, I think, is to remind parents and adults that we should use other adults for the more complicated expressions of talking about the finances, talking about our worries about specific issues related to our own experiences of the pandemic. So there are adult conversations to be had, but when a child can see that we're having feelings, and even infants can do that, it's okay to acknowledge that it happened.
And Dr. Alexander, back to you. What are some strategies to mitigate mental stress of the pandemic and even everyday living that's experienced by disenfranchised and marginalized populations?
Wow, that's an excellent question. Um, I think this pandemic has disproportionately affected marginalized communities. When you look at the African American unemployment rate, at the height of the pandemic, it was almost 2 to 3 times higher than that of whites. And many African American families were food insecure, meaning they did not have enough food to put on the tables for their children and families. And so if you're concerned about this, like I'm concerned about this, I think one of the great ways to help is by going out and serving those communities. As I said earlier during my presentation, churches, Black churches, white churches, and many churches came together and said, we have to do something about the vulnerable communities during this crisis. Otherwise, we're going to create social conditions that could lead to harmful outcomes in the future. And what did they do? They partnered with World Vision and provided over 2 million pounds of food to 50,000 families and 150,000 individuals. This is a time we have to come together as a group in order to help marginalized communities. We can't just do it individually. We have to be a team here. We're all Americans and we're all a part of this nation. So that's my recommendation, to come together and to help vulnerable communities.
Excellent, thank you. And this will actually be our last question of the evening. We have a few minutes. So both Dr. Alexander and Dr. Gleason, first of all, thank you again for your wonderful, insightful comments thus far. What are final thoughts that you have for our audience, the moms, the dads, the grandparents, other caregivers, family, friends, and others who tuned in tonight that simply want to help others get through the pandemic? What are some final thoughts that you have for them?
Well, this is, I think, a great way to close this event. So there's a person I admire, Will Smith. He once said a great quote. He said, when you build a wall, you don't think about building a wall. Actually, what you do is you take one brick and you lay that brick as perfectly as a brick can be laid. And you do that each day, and soon you'll look back and you'll have a wall. And so the strategies I've given the audience today are not going to solve problems overnight. They're actually very simple and modest strategies. But I guarantee you, if you practice them as perfectly as you can, to the best of your ability each day, I guarantee you, you'll look back in a year and say, man, I really made an impact on my mental health. And so that's what I'm going to encourage the audience to do going away from this presentation.
Dr. Gleason?
So I think what I would say to everyone who came tonight, thank you. Thank you for thinking about children and families and yourselves. That's such an important step as we all work to move through this pandemic and with our mental health stronger, ideally, but certainly intact. So the act of being here with us tonight, I think, is such a sign of your commitment to well-being and to recovery from this event. You're doing what it takes to support yourselves and your family members. I think the next steps are making sure we're all taking care of ourselves. The self-care practices that Dr. Alexander was mentioning are key. Looking out for our own health, our own emotional health, is one of the most important things we can do to support the well-being of the children in our lives. Noticing their feelings, giving them space to talk about them, and then together as a society, we need to be working towards that next vaccination, immunizing children against the toxic effects of the stresses that have come with COVID-19. And I'm excited about the number of people who have come and asked questions tonight and joined us, because I think that speaks to the commitment to work towards that second vaccine. So thank you all.
Great. And again, thank you so much, Dr. Alexander, Dr. Gleason, for your amazingly informative presentations and your candid thoughts on the COVID-19's impact on families and children. Clearly, you provided content that we all can use to navigate these challenging times as we move forward and work to stabilize our homes and our families. Again, thank you so much. And thank you to the audience as well. And let me now turn the program back over to Dr. Rice.
I too thank you, Dr. Alexander and Dr. Gleason. That was amazing. And I learned so much to help myself with self-care and to also help all of those in my neighborhood and my friends to give them some pointers and some strategies. So thank you so much. And thank you, Dr. Romero, for so ably moderating our event. You did a fantastic job, and we are so thankful that you were willing to do this for us. After this event, you will find mental health resources, including the presenter's slides, a recording of this presentation, phone numbers for local mental health assistance, and other resources that we think will be helpful for you. We hope that you do find them helpful, and we do hope that you go to the Hampton Roads Community Foundation website and seek these resources to maybe do a deeper understanding of this issue. The next Understanding Hampton Roads event, Hurricanes Before and After the Storm, will explore hurricane preparation and how Old Dominion University is using technology to enhance the region's response to recovery should a hurricane hit our region. That event will be held on May 25th at 6 p.m. Please think about registering for that event. Again, I would love to thank our audience for participating in this event tonight. It was a wonderful evening where we could all learn from each other.